The term diarrhea refers to loose, watery, and sometimes more frequent bowel movements. It is the only symptom in certain cases. Other times, it might be linked to additional symptoms like weight loss, nausea, vomiting, or abdominal pain. Fortunately, diarrhea rarely persists longer than a few days. However, diarrhea that persists for more than a few days or even weeks typically indicates the presence of another issue, such as irritable bowel syndrome, IBS, or a more serious condition such as inflammatory bowel disease, IBD, celiac disease, or persistent infection. Signs and symptoms. Diarrhea, loose, watery stools, can cause the following symptoms: pain or cramping in the belly, bloating, sickness, vomiting, high temperature, blood in the stool, serum in the bowel. The need for a bowel movement is urgent. Causes. Diarrhea can be brought on by a variety of illnesses and ailments, including pathogens, enteric adenoviruses, cytomegalovirus, astrovirus, Norwalk virus, also known as norovirus, and viral hepatitis are among the viruses that can cause diarrhea. One common cause of acute diarrhea in children is rotavirus. In addition to causing coronavirus disease 2019 or COVID-19, the virus has also been linked to gastrointestinal symptoms like diarrhea, vomiting, and nausea. Parasites and bacteria. Diarrhea is brought on by exposure to certain bacteria like E. coli or parasites through tainted food or water. Traveler's diarrhea is the term used to describe diarrhea brought on by bacteria and parasites that occurs when visiting developing nations. Another type of bacteria that causes diarrhea is Clostridium difficile, or C. diff. This type of bacteria can cause diarrhea during or after an antibiotic course. Pharmaceuticals. Diarrhea is a side effect of many medications, including antibiotics. Antibiotics work by killing both good and bad bacteria, which is how they eradicate infections. This throws off the natural bacterial balance in your intestines, which can result in diarrhea or infections like C. diff. Additionally, anti-cancer medications and magnesium-containing antacids can also induce diarrhea. Intolerance to lactose. A sugar present in milk and other dairy products is called lactose. After consuming dairy products, those with lactose intolerances experience diarrhea because levels of the enzyme that aids in lactose digestion decline with age. Lactose intolerance may worsen with age. Glucose. A natural sugar present in fruits and honey is called fructose. It is occasionally added to some drinks as a sweetener. For some individuals, fructose intolerance can cause diarrhea. Constructed sweeteners. Chewing gum and other sugar-free products contain non-absorbable sugars called sorbitol, erythritol, and mannitol, artificial sweeteners that can cause diarrhea in some otherwise healthy individuals. Medical procedures. Diarrhea can occasionally result from surgeries to remove the gallbladder or partial intestine. Additional digestive illnesses. There are several other causes of chronic diarrhea, including small intestinal bacterial overgrowth, SIBO, ulcerative colitis, Crohn's disease, celiac disease, and IBS. Prevention. Preventing infectious diarrhea. To stop the spread of contagious diarrhea, wash your hands. To guarantee proper hand washing, wash frequently, both before and after preparing food. Wash your hands. After handling raw meat, using the restroom, changing diapers, sneezing, coughing, or blowing your nose, wash your hands. Use soap and lather for at least 20 seconds. Rub your hands together for at least 20 seconds after applying soap. This is approximately the duration required to recite Happy Birthday twice. If washing isn't an option, use hand sanitizer instead. When access to a sink is not possible, use an alcohol-based hand sanitizer. Make sure to cover both the front and back of both hands when applying the hand sanitizer, just like you would with hand lotion. Make sure the product you use has at least 60% alcohol in it. Preventing travelers' diarrhea. When people travel to nations with poor sanitation and tainted food, they frequently get diarrhea. Keep an eye on what you eat to lower your risk. Eat hot, properly prepared food. Eat only raw fruits and vegetables that you are able to peel yourself. Avoid consuming undercooked or raw meats and dairy products. Reconsider your hydration. Sip wine, soda, beer, or bottled water straight from the bottle. Avoid using ice cubes or drinking tap water. For even your teeth brushing, use bottled water. When you take a shower, keep your mouth shut. Coffee and tea, which are made with boiled water, are most likely safe. Keep in mind that caffeine and alcohol can exacerbate diarrhea and make dehydration worse. Inquire about antibiotics from your medical team. Before you go, especially if you have a compromised immune system, Ask a member of your healthcare team about antibiotics if you will be spending a significant amount of time in a developing nation. Seek out any travel advisories. On its website for travelers' health, the Centers for Disease Control and Prevention posts disease advisories for a number of different nations. If you intend to travel outside of the U.S., see what advice and cautions are available there to lower your risk.